Well, hello there, everyone. I'm Dr. Leslie Kernisan, board-certified geriatrician and founder of the website betterhealthwhileaging.net. And this is the Better Health While Aging video podcast, where we discuss common health problems that affect people over age 60 and the best ways to prevent and manage those problems. In today's episode, I'm going to talk about common urinary issues in older men, including incontinence. Now, urinary incontinence is a problem that affects people of all genders, especially in later life. However, since pelvic anatomy does make a difference in how men and women tend to experience urinary issues, I'm covering men and women in separate episodes. So, in a recent episode, I covered women and incontinence issues in older women. So if that's your concern, I highly recommend you take a look at that episode. And now in this episode, I'm going to cover men. And specifically, in this episode, I'm going to start with the basics of male anatomy of the bladder, the pelvis, the prostate, and how that affects urination. And then I'm going to talk about something that in medicine we call LUTS, which stands for Lower Urinary Tract Syndrome. Basically, it's symptoms related to storing urine and voiding urine that tend to get worse as people get older. And incontinence is closely related to LUTS, but not entirely the same. So after I talk about LUTS, I'm going to talk about 5 types of urinary incontinence that can affect men. And then I'm going to go into how should it be medically evaluated and what are treatment options, both for LUTS and for incontinence in older men. And as part of that, I am going to talk about treatment of a common condition that you may have heard of, BPH, which stands for Benign Prostatic Hyperplasia. So this episode is not going to be all about everything about the prostate, but the prostate is often very involved in the urination issues of older men. So I'm going to talk a bit about that. I'm going to talk a bit about special considerations in geriatrics, especially when it comes to older men who are quite older, quite frail, maybe have a memory problem or a diagnosis such as Alzheimer's or dementia. And then I'm going to finish with just my suggestions on what you can do if you're concerned. So we're going to get going with that. But before I get started, I have a very quick request, which is if you're here, you find this topic interesting, or you've been finding my video podcast interesting, if you haven't subscribed yet, if you could please go ahead and do that, it would mean a lot to me. It does help me out. It helps other people find the channel when you subscribe, and it helps support the work I'm doing. Another option, if you appreciate my making these videos, is to become a member of this Better Health While Aging YouTube channel. And to learn more about that, just click the join button that you'll see right beneath this video. Okay, let's now move on to urinary issues in older men. So we're going to start with anatomy, the male bladder and how it's situated and how that affects urination. So similar to women, urine is produced in the kidneys. You have 2 of them in your low back, and it drains through 2 tubes called ureters into the bladder. So sometimes when people get, kidney stones and that's painful, those are stones that are often lodged in the ureter. And then from the bladder is designed to store the urine. To exit the body, the urine has to exit through what's called the urethra. And similar to women, men have 2 urethral sphincters. So they have one internal one right at the outlet of the bladder, which is not under voluntary control. And then they have an external one, which is not at the tip of the penis. It's actually kind of at the bottom of the pelvis. That's where the external sphincter is, and that is under voluntary control. And then the bladder itself is this muscular organ, but it's not made of like muscles like your arms that you can consciously flex or relax. It's made of a special type of smooth muscle. And it's designed to store urine to stretch out as the amount of urine increases. And so when it stretches, it sends signals to the brain. That's what gives you that feeling, I have to pee. And so then in normal urination, you start feeling that feeling, I have to pee. And at a suitable moment, the brain initiates urination, which causes the bladder to squeeze, the urethral sphincters to relax, and the urine can hence exit the body. So this does require normal nerve function to coordinate. So occasionally, especially there's a minority of people who have had spinal injuries or problems really affecting the nerve function in their lower body. That can definitely affect urination. But ideally, nerves are working properly, and that's how the process should work. Let me now talk about pelvic anatomy in men and the prostate. So men do have different anatomy than women. Not only do they not have a vagina and uterus, but they have a prostate that is there. So if you look at, a diagram, a cross section of the male anatomy, what you can see is that the prostate is essentially like right under the bladder, and the urethra has to go through the prostate, and then it goes through the penis to exit at the tip of the penis. So this is important because what happens to most men is as they get older, their prostate tends to get bigger. This is a very common condition that we call benign prostatic hyperplasia. The cells just multiply and get bigger. And as it's doing that, it starts to often put a little bit of pressure on the outlet of the bladder and on that part of the urethra that is going through. And this means that it can make it a little bit harder to pee. What you'll also see from the cross-section is that the rectum is behind the bladder and prostate. So this mostly means that, if people are constipated or have things going on with their rectum, that can also affect how their bladder feels or how their urination works. Last but not least, men also have a pelvic floor, which is this layer of muscles and ligaments that sits kind of like a hammock at the bottom of the pelvis. It extends from the pubic bone to the tailbone and also between the sits bones. So these muscles not only hold up your internal organs, but they're also involved in urination and also defecation. They tighten to keep you continent, and they must relax to allow voiding. Now, the pelvic floor ends up being very relevant when it comes to women and urinary issues. That's because women, especially due to childbirth, have often had a lot of pressure there, a lot of stretching. And so pelvic floor dysfunction is fairly common in women as they get older. We know less about it in men, but it is also possibly something that affects men as well. So it's not generally going to be the first thing we think about in men, the way it's something we think about quite early for women, but it is potentially something that can affect urination and continence in men as well. So given that, let me now talk about something called LUTS, lower urinary tract symptoms in older men. So this is a collection of symptoms that become very common as men age and that are related to the storage of urine and the releasing of urine. It includes symptoms such as urgent urges to urinate, frequent daytime urination, nighttime urination, incontinence, which we generally define as involuntary leaking of urine, slow or intermittent urinary stream, difficulty starting the stream, straining to urinate, dribbling at the end or soon after urinating, feeling some discomfort with urination, or feeling of an incomplete bladder emptying. And I didn't group them this way, but in general, you can kind of group these types of symptoms into three categories. The ones that men might feel before they urinate, right? Like feeling often like you have to pee or urgently getting a feeling like I got to go soon. Symptoms that emerge as they are peeing, and then symptoms that emerge after peeing. So what you need to know about LUTS is a couple things. First of all, it is extremely common. It increases with age. Studies have estimated that about half of men over age 65 have, at least moderate symptoms of LUTS, and that proportion gets higher as men get older. So when we're talking about men in their 70s, 80s, 90s, the proportion of people experiencing this is very common. So if you are an older man and you've experienced any of these, you are not alone. So what causes LUTS? It's thought that the primary cause for most men is going to be the fact that prostate is getting bigger as they get older. And most older men do have some degree of what we call BPH, benign prostatic hyperplasia, which causes, in most cases, some associated bladder outlet obstruction. It also turns out that they believe that for some men, possibly many men, there is also a component of overactive bladder. And by this, I mean the bladder contracting involuntarily when your brain is not signaling it's time to urinate. So ideally, the bladder doesn't really contract unless your brain has initiated that it's time to pee sequence. But we know that some people's bladders become kind of twitchy, right? For various reasons. And sometimes it's because the bladder is chronically a little bit more distended than it should be because people aren't peeing as often as they should or aren't emptying their bladder all the way. So LUTS is thought to be a combination of bladder outlet obstruction due to an enlarged prostate and some overactive bladder. And in many men, there's going to be a mix, whereas in some, it might be mostly a sort of large prostate kind of issue. Now, what's also a possible cause of LUTS symptoms, but would be less common, is having something else causing an obstruction to the outlet of the bladder, such as a urethral stricture. It can be like a narrowing of the urethra. It can happen for a variety of reasons. Sometimes there's an actual obstruction maybe a mass or tumor in the bladder neck. Sometimes it can be something actually kind of bulging from the rectum that is causing that. And, there are a couple other possibilities. So most of the time, LUTS is due to the prostate and maybe overactive bladder, but it's true that occasionally there is something less common going on. Now, should you worry if you have LUTS? Well, probably not, because the vast majority of the time, LUTS is benign. So yes, if you're having urinary symptoms, generally it's a good idea to mention it to your health provider, because they will partly ask you some additional questions to make sure there aren't some red flag signs, indicating more evaluation is necessary. But the vast majority of the time, it's again due to, a growing prostate, maybe some overactive bladder. And for many older men, they have some of these symptoms, but they're not actually being that bothered by them. So if the symptoms are feeling minimally bothersome, and that's partly a judgment call for the man, you don't necessarily need to worry, and you don't necessarily need to get any treatment. However, if the symptoms are bothersome or are including incontinence, which for most men does qualify as a bothersome symptom, then it is a good idea to talk to your medical provider. Again, they can look into it a little bit more, and they can also help you take some steps to reduce the symptoms and reduce the issues. Now, you may be wondering, well, but do I need to tell my doctor about these things? Because the studies show that men in particular are not very likely to bring up urinary issues to their health providers. But I think that's a mistake. I think it actually is worth bringing up to your provider, especially if you are having involuntary leakage of urine or other symptoms that are really bothersome or distressing. This is an important issue for health and quality of life. You don't want to just chalk it up to getting old. Yes, this becomes common as people get older, but that doesn't mean there is nothing to do about it. Incontinence issues and other LUTS symptoms often can be treated and managed. But successful treatment depends on a few things. One is getting some evaluation so that you get help identifying what type of incontinence you have. You also want to get help identifying any related prostate issues. It's probably safe to assume they're probably there, so potentially getting some treatment and management for them. And then also health providers can help identify and mitigate any exacerbating factors, such as medications or extra weight. So given that, what are the types of incontinence that might be affecting you if you are an older man? So generally, we're going to be thinking about 5 types of urinary incontinence. These are the same 5 types that can affect women. They just happen in different proportions in men. So in men, it's not stress incontinence that's most common. It's actually urge incontinence, meaning sudden, strong urges to pee, sometimes accompanied by leaking of urine. And that is often assumed to be related to an overactive bladder. In men, they'll often be a component of enlarged prostate as well. And then men can experience stress incontinence. So stress incontinence, first of all, means leaking urine when you exert yourself, when you sneeze, when you cough, when you bear down. So this is quite common in women, especially if they've had children. In men, it's a little less common. In men, we see it especially in men who have had prostate surgery or other kind of procedures done down there in the pelvis. Then there is mixed incontinence, which means a mix of stress and urge. Next, we have overflow incontinence. So this is incontinence that happens when the bladder gets very full, is not emptying properly. And so once it's so full that there's a lot of pressure on the bladder, that often forces out urine, even if one doesn't want to urinate. And so when men are experiencing overflow incontinence, the extra urine is often dribbling or leaking out. They can't control it. And so this can be related to a condition that's called urinary retention, which is basically when you're having so much trouble releasing urine that you have quite a large volume in the bladder. This is an important condition to identify when it happens. I actually, can think of somebody, an older person I know who started experiencing this frequent dribbling and leaking and some abdominal discomfort and was told that it was a urinary tract infection and started antibiotics for a urinary tract infection. And in fact, what he had was retention. He had a very enlarged prostate and his bladder was just getting bigger and bigger. And what happens when it gets that big and the urine is really barely coming out is that the urine can back up into the kidneys and can start to affect the kidneys and can even in certain cases cause acute kidney failure. So we always want to be a little bit, on the lookout. Could somebody be experiencing actual retention? And then there's functional incontinence. So functional incontinence is incontinence that is caused by physical or cognitive impairments that interfere with a person getting to the bathroom and toileting themselves as necessary. So if somebody has a lot of mobility, problems and can't get to the bathroom, or maybe they're having memory problems and they're forgetting to go, or they're disorganized, that would be called functional incontinence. So those are the 5 types of incontinence that we want to be thinking about. So let's now talk about how should urinary incontinence be medically evaluated. So again, I highly recommend if you are experiencing any urinary incontinence that you bring it up to your health provider so that they can help you out. And normally it should start with a good interview to get more information regarding your symptoms. And they will ask about, ideally, all the LUTS symptoms. They'll also want to know for any incontinence you're having, what is the frequency, what is the volume of what comes out, how severe is the incontinence, what seems to trigger it, how's the strength of your urinary stream. Also, when they ask questions, they'll be checking for related medical conditions and also sort of any signs that, further evaluation or treatment might be more urgent. They should ask you about your intake of fluids overall, your intake of alcohol and caffeine. And then it will really help the process if you can bring in a diary of how often you are going to pee, how often you have leaks, what seems to be going on around that. That's extremely helpful too. So if you're going to talk to your health provider about it, I really recommend that. And then the health provider should do a physical examination. So when it comes to men, often part of that examination is a rectal examination to feel the prostate and assess its size overall. And then they might also do an abdominal exam and kind of palpate the belly after the man has had a chance to pass urine to see if they can still feel the bladder. And then it's really important to look over medications when an older person is experiencing LUTS symptoms or incontinence, because there are quite a lot of medications that can be implicated. In particular, there are some that are known to contribute to retention and difficulty emptying one's bladder. So these include anticholinergics, which is that large class of medications that I've covered in a previous video, because they also, anticholinergics interfere with the transmission of acetylcholine, a neurotransmitter that is used throughout the body. It is used in the bladder, but it is also used in the brain. And when we interfere with the transmission of acetylcholine, people's thinking is worse. They are sedated. They can get more confused. So common medications that are anticholinergic include things like Benadryl, for instance, and I have a whole list of other common ones, over the counter and prescription. So many of these medications do impair bladder contractions. In fact, some medications specifically for overactive bladder, that is how they work. But especially if we've had concerns about a man retaining urine, we want to be careful about them being on any anticholinergics. That'll make that worse. The other thing that can contribute to retention is decongestants, actually, because the way decongestants work is that they get your vessels there in your nose to kind of tighten up. So that's why, as a side effect, they can raise blood pressure, but they can also, as they get the smooth muscle lining vessels to tighten up, it's that similar kind of smooth muscle that is in the urethra that will tighten up. And so that'll make your urethral sphincter tighter, which can make it harder to emit urine. So especially for men who seem to be having difficulty emptying their bladder, we want to take a good look at their medication list, see if they're on any of these medications. And then there are medications people can be on that increase urine production. So the, prime example would be diuretics, which we prescribe often for people who have heart failure or maybe have a kidney condition. So these can worsen incontinence. There are also some medical conditions that can also cause increased production of urine that can be an issue as well. And so I'm specifically talking about medications that can affect retention, because this is something that comes up especially for older men. It does not come up nearly as often for women because women do not have a prostate in the way of their urination, but men do, and prostates tend to get bigger with age. So also as part of the evaluation might be some lab work. So specifically, it's fairly common to check the urine. So usually they're checking for microscopic blood, they're checking for glucose, they're checking for a few other things. And then they might consider the possibility of a urinary tract infection. Now, men have often had these urinary symptoms for months and months and months. If that's the case, it's extremely unlikely that it is a UTI. And we really only want to get a culture if they have clinical symptoms of UTI, which would include things like fever, a really recent change in their urinary symptoms, burning or pain when they pee, pain in the lower abdomen, pain in the lower back. And if you want to know more about symptoms of UTI, I have a video about that. We don't just want to culture the urine because often older men can have their bladder colonized with bacteria. That's fairly common as people get older. It's called asymptomatic bacteriuria. Another test that is often done is the prostate-specific antigen, the PSA. So you may be familiar with this test because it's also potentially used as part of prostate cancer screening. Now, should it be used once men get to a certain age? That has been debated. But the PSA can also be used as a proxy for prostate volume. So if you haven't had your PSA checked before, you could definitely discuss it with your health providers. If you're thinking of it, also for prostate cancer screening purposes, definitely discuss the pros and cons. It's usually mainly considered in people with a 10 plus life expectancy, and your doctor should be able to talk you through that. And then is there more evaluation to do? So generally, primary care providers can get started helping an older man with LUTS symptoms or with some incontinence issues on their own. But it is possible to get additional evaluation, especially in urology clinic. And some tests there that are sometimes done include what's called a post-void residual, which is when they check for how much urine is left in the bladder after an older man urinates. So often they have a special ultrasound that will do that, or sometimes they'll pass a catheter and see what drains out. They can also do some basic bladder stress testing, ask the person to, bear down after they've filled their bladder, or they can do urodynamic testing, which is more involved testing, where they put in a special pressure sensor into the bladder. They sort of increase, put actual more fluid in the bladder, see at what point the bladder starts contracting, and that can sometimes be useful. This is really not thought to be necessary for, the first line attempt to treat and manage, but these are some tests that you might hear about, and they can be especially useful if it's unclear what type of incontinence a person has or if the first line treatments have failed. Now, most of the time, it's not, urgent to address these issues. It's an important quality of life issues. But sometimes there are indications that, more urgent attention is needed. So things to look out for here include, first and foremost, urinary retention. I mean, if it looks like the person is barely able to empty their bladder, and when this happens, it's often actually palpable. You can feel kind of, like a ball in the person's belly if they're having retention. I remember this happened to me actually during my first year of residency, seeing an older man in urgent care, and I felt his belly and I thought, oh my gosh, he has a huge mass. And it was just his distended bladder full of urine because he hadn't been able to urinate for, I forget how long it was. So we helped him out. Whew, good thing he came in. And when people are having urinary retention, they're post-void residual. You could have partial retention, right? You're retaining more urine than you should, but you're still getting some out. And often if we check that people have more than 200 milliliters of urine in their bladder, but if it's over 300 milliliters, then it's really recommended to place a catheter to fully drain the bladder and check the kidney function, make sure the kidneys haven't been affected. Other indications for urgent attention include neurological changes. If people are getting numbness or tingling or weakness in their legs, in their butt, in the area, the skin, around their anus, that requires attention. If there's concerns for a urologic cancer, such as blood in the urine or a hard nodule on the prostate, if they're having a lot of pain in their pelvis, that's not normal either, or if the incontinence has come on really suddenly. Those would be indications that more urgent attention is necessary. Last but not least, if the medical staff are unable to pass a urinary catheter, that's also an indication to get urology involved as soon as you can. So let's now talk about treatment. So how do we treat LUTS and urinary incontinence? So most of the time, these conditions are benign, but they are important quality of life issues. And what can we do? So first of all, health providers should start by addressing any related medications and any related medical conditions that, might be affecting the function of the bladder or generating a lot of extra urine. And often treatment for an enlarged prostate, for that, benign prostatic hyperplasia, BPH, may be necessary. I'm going to speak more to that in a moment. And then certain lifestyle modifications are recommended for all types of incontinence and bothersome LUTS. First and foremost is treating and avoiding constipation. When people are constipated, the rectum and the lower colon can be putting pressure on the bladder or potentially even, getting close to the urethra. and that does not help matters. So treating and avoiding constipation is a mainstay. Losing weight often helps men as well if they were overweight in the first place. Limiting alcohol and caffeine. Alcohol is a diuretic. Caffeine can be a mild irritant to the bladder. Avoiding drinking large volumes of fluid at one time and limiting fluid before bed or travel can help as well. Some additional lifestyle measures to consider that can help men are timed avoiding. So this basically means setting yourself up to pee on a schedule. They usually have men start off with every 90 to 120 minutes. So that's every hour and a half to 2 hours. And this can be good for those who are having some obstructive symptoms. So obstructive symptoms include, a weaker stream, a little bit of difficulty getting started. Another technique that is sometimes taught to men is something called double voiding. That's when they make a second attempt to pee within 1 to 2 minutes of the initial void. That can also be helpful for obstructive symptoms. And then there's pelvic floor training, which means doing a Kegel at the time of urinary urgency and otherwise training the pelvic floor. For some men, it really helps to see a pelvic PT for this. And this can be considered, a form of bladder training and pelvic floor strengthening. And this can help with urgency symptoms. Now, let's get a little bit more into medical treatment of the prostates. And I want to talk a little bit more about that relationship of the enlarged prostate with LUTS and incontinence. So again, an enlarged prostate, BPH, is the most common underlying cause of LUTS and a common contributor to continence issues. And this is one where often it's reasonable for PCPs to treat with medication. And so there are two types of medication that work especially well for this. One type is of a class called alpha-1 blockers. And the way these work is they basically relax that smooth muscle in the urethra and at the sphincter. A popular one that has been used for quite some time is the medication tamsulosin. The brand name is Flomax. An older medication in the same class is terazosin. The brand name is Hytrin. And there are a few others that you may have heard of as well. So these medications do often help men urinate more easily, often within a few days. The downside is just as they're relaxing your urethral sphincter, they are also relaxing the muscles in your blood vessels. So they do tend to drop blood pressure. And in particular, they're associated with what is called orthostatic hypotension, which is when an older person stands up and their blood pressure initially drops. For a few minutes, they can get dizzy and lightheaded. This can contribute to falls in older adults. I have more about this in my video on low blood pressure. So we're often attentive to that in geriatrics. If an older person has had falls or near falls, are they on this kind of medication? Do we need to think about dialing that back? Or maybe if they're on one of these prostate medications and also blood pressure medications, do we need to make some adjustments? And then there's a different class of medication called 5-alpha reductase inhibitors. These include medications such as finasteride, brand name Proscar, and dutasteride, brand name Avodart. So the way these medications work is that they block the effect of testosterone on the prostate. And so over time, but it takes time, like 6 to 12 months, the prostate stops growing as much and might even shrink a bit. So these do work. They just take quite a while to work. So those are the main medications that are used to treat BPH. And so if a man seems to have an enlarged prostate, has been having related continence issues or other LUTS symptoms, totally reasonable to start medication to treat that aspect of the issue. And then there are some other medications that are sometimes used for incontinence, specifically to reduce bladder contraction. So these are medications that work if there is a component of overactive bladder contributing to symptoms or incontinence. These are worth considering. However, since many of these medications are anticholinergic, that's why they work on the bladder, it's really recommended that men first start by giving it a good try with lifestyle measures and medication for BPH before they add on medication to try to reduce bladder contractions. And so most medications for bladder contractions, overactive bladder, fall in a class called antimuscarinics. That's because the acetylcholine receptors in the bladder are of a subtype called muscarinic receptors. And these medications generally are going to be anticholinergic. Some common ones that are used for overactive bladder include oxybutynin, tolterodine, solifenacin, derifenacin, and trospium. The brand names are Ditropan, Detrol, Vesicare, Enablex, and Sanctura. So these do often reduce bladder contractions, but they also cause these anticholinergic side effects such as dry mouth, dry eye, constipation actually, sedation. They also can cause urinary retention in men. You can kind of go too far in reducing bladder contractions and end up with retention. And they can worsen cognitive function, especially in men who are already having difficulty with their memory or thinking. So those should be used with caution by older men for sure. Now, there is a newer class of overactive bladder medication that became available a little over 10 years ago. They also work to relax the smooth muscle of the bladder, but they work through a different receptor. They are called beta-3 adrenergic agonists. And the one that's probably best known is mirabegron, brand name Myrbetriq, and there's a newer one as well. So what's good about this is that this is a way to relax the bladder without having all those anticholinergic side effects. These medications do have some known side effects as well, but they're less problematic in older adults. The bigger problem for older adults is generally that since these are newer medications, they tend to be more expensive. They may not be covered by your drug formulary, or they may cost you more. And that is why they're still used less often than the older anticholinergic overactive bladder drugs. So if you are sure there's a component of overactive bladder going on in your situation and you've already tried the lifestyle measures, tried medication for BPH, it's reasonable to try medication for urinary incontinence. Just bear in mind that although often people see some changes within a week, it can take up to 12 weeks for the full effect. So those are the mainstays of treatment. And then there are a couple other treatment options that come up, especially if first-line treatment hasn't been working. So some next-level treatments might include, so one option is surgery to reduce the obstruction caused by an enlarged prostate. There are a couple different surgeries that they can do today. Another possibility is to use Botox, actually, for an overactive bladder. There are also special nerve stimulation technologies available as well. So those are some options out there. But again, generally men want to start by doing a trial of lifestyle therapies and almost always BPH medication before considering surgery. Okay, let me now talk about some special consideration when it comes to geriatrics, so specifically frail older men. Incontinence and LUTS can be addressed in frail older men, but it's definitely more challenging. And there are a couple of reasons for this. So first of all, some of them are experiencing difficulty with their memory and thinking. They have some form of cognitive impairment. Maybe they even have a dementia diagnosis, such as Alzheimer's or another form of dementia. And this can make it hard for them to report their symptoms so that we can sort out what type of incontinence they're having. It can be very hard for them to keep avoiding diarrhea. It may be just that the people taking care of them are noticing that they're often wet, but it can be hard to sort of suss out like the details of that so that we can troubleshoot it. When people are frail and older, if they're feeling unwell or they're very tired, or again, if they're having memory difficulties, they may not have the energy, motivation, or capacity to implement some of the lifestyle measures, such as bladder training, or they may have trouble putting themselves on a schedule unless someone else really helps them with that. Some of them are experiencing functional incontinence, right, where the toileting difficulties are in part due to mobility difficulties or cognitive difficulties getting in the way. And then frail older adults are especially more likely to experience side effects from certain medications, especially those medications, those anticholinergic medications for overactive bladder. They're also much more likely to experience falls or near falls from the alpha blockers for BPH, those medications like tamsulosin, brand name Flomax. So we have to be careful about that. So there is a mnemonic that we're taught in geriatrics called diapers that is meant to help us think of things that might be causing or related to incontinence in frail older adults. D is for delirium. That is that worse than usual mental state that people can get into when they're very sick or if they're hospitalized or if they've just had surgery. So that can definitely cause continence issues to be worse. I is for infection, such as potentially a UTI, but remember, we only want to check for UTI if they're having other clinical symptoms such as fever, burning when they pee, or some of those other symptoms. A is for atrophic urethritis and vaginitis. This is one that applies much more to women. Women postmenopausally have a drop in estrogen that tends to make the tissues in their pelvis and around their urethra very thin. This doesn't really affect men, so we'll strike that one for men. Pharmaceuticals means medications. Are there medications that might be contributing to retention or increased urethral sphincter tone or otherwise causing the creation of a lot of urine? P is for psychological disorders. Those are sometimes playing a role. E is for excessive urine outputs. So, for instance, when people have heart failure, they might be urinating more, especially if they're put on diuretics or if they have high blood sugar. High blood sugar tends to, once it gets to a certain point, will cause the kidneys to start releasing a lot of fluid along with the excess sugar. R is for restricted mobility, and S is for stool impaction, such as constipation. So given that, what are our options for managing incontinence in frail older men? So despite the challenges, we still want to see if we can identify the type of incontinence, if at all possible. Sometimes having a caregiver track the symptoms can really help quite a lot. Even frail older men who are having, memory difficulties or mobility problems can benefit from medications for BPH. So especially if we try something, one of those alpha blockers, such as tamsulosin, brand name Flomax, we generally are going to want to monitor for orthostatic blood pressure changes. That means checking the blood pressure sitting and standing, making sure they're not having a drop when they stand up, making sure their blood pressure is not too low in general. The other type of medication, the 5-alpha reductase inhibitors like Proscar, that's generic name finasteride, those are generally well tolerated even in people who are frail. Time toileting can still work for frail older adults. They might need somebody to help them with that, but that's a method that we sometimes use. And then also just managing continence through, pads and proper incontinence supplies and protecting the skin with barrier creams also becomes important as well. Last but not least, especially when it comes to frail older adults who may be having difficulty with their memory or thinking, we want to be really careful about anticholinergic medications for overactive bladder and only use them if absolutely necessary. So given all that, what should you do if you are concerned about incontinence or LUTS and you are an older man, or maybe you're concerned about an older man in your life? My suggestions are, one, if you can keep a voiding diary for at least a few days, that's really going to help the health providers when you come in. So what exactly are the symptoms you're noticing? You can even Google, LUTS questionnaire. You can go back and find my list. Ask yourself which of those is affecting you. Is it every day? If you're having leaks, how much, how often, what seems to bring it on? That's really helpful. And then, yes, I recommend you tell your health provider and ask for evaluation and assistance. Don't assume that it's normal for aging or that there is nothing to do. Once they've evaluated you, and hopefully they won't have found any red flags or anything like that, ask them to sort of like talk to you a little bit about, what they're noticing, what their current hypotheses are. What type of incontinence or LUTS do they think you have? Do they think BPH is playing an important role? Are you already being treated for that? Do you need an adjustment in treatment for that? And some things that might be useful for you to find out is, do your symptoms seem to be more obstructive, right? Like you're having difficulty getting the urine out? Or does it seem to be more overactive bladder? Your bladder is squeezing, often. Does it seem to be a mix? And do you need more treatment for BPH? Those would be some of my recommended questions that you could ask your health provider. Otherwise, remember, most LUTS is due to BPH, and it can be mitigated with medication to improve the urinary stream and to slow prostate growth. So I recommend considering that. Again, be careful about anticholinergic medications for overactive bladders because those medications are on our BEERS list. That's our geriatrician's list of medications that older adults should avoid or use with caution because of the potential impact on cognition. They also, making people drowsy can contribute to falls. And then remember, it's important to treat and avoid constipation. If you want to know more about how to do that, I have a video about constipation that goes into that in depth. And then you should know that there are some other lifestyle measures that might be helpful to you, such as timed voiding, double voiding, or bladder training. And with that, thank you so much for watching. I'm going to wrap this episode up. So if you found this video podcast helpful, if you're here on YouTube, please go ahead and subscribe. It does help more people find the channel. If you've been listening to the audio version on the podcast feed, please come and take a look at the video. If you get a chance, you'll see my key points on the screen. So thank you once again. If you are affected by LUTS or continence issues, I hope this video has been helpful to you. And I definitely look forward to seeing you all again on a future episode of the Better Health While Aging video podcast.